Johan, today in clinical studies it's very common to use different strata. What are the dangers what are the risks that might appear here and how to detect them?
Stratification is sometimes really important because it's going to help our sponsor companies to boil down the entire potential population with a particular disease or therapeutic area or indication, boil it down to those patients that really benefit from the drug. There are different ways of stratification. It could be a stratification by age, it could be a stratification by gender, it could be stratification of the stage in oncology, for instance. So stratification and the balance in the stratification is really important. We encountered a study where obviously the stratification either was not adhered to or the IVRS system didn't really work properly. But at least what happened is that the stratification as originally planned per protocol did not work out in the study, so the data, the patients enrolled were not allocated to the appropriate stratum. We talked about stratification, which is one aspect, but I think what is also important is a proper randomization in the first place, and many studies these days are being randomized. For randomization, these days, usually we use again IXRS, trying to make sure that the randomization works according to plan, that eventually I have 600 patients in treatment group A and 600 patients in treatment group B, and do not have, for whatever reason, a complete imbalance in those two treatment groups, because that could cause afterwards problems in the statistical analysis again and the interpretation of the data.